So today I'm going to spend my time talking about the facts and figures. I know some of you are quite familiar with them. Just by a show of hands, I have talked to a number of people. I know many of you work in the field. Are there any family caregivers here today? Okay. I just want to make sure that what I have to say is relevant to everybody in the room. So I'll be talking about the facts and figures. We're going to be talking about prevalence. Some of you have seen some of the prevalence data and have been as shocked as me at where Maryland stands in prevalence. And I know a lot of you are doing things at the local level to try and change that trajectory. Also going to talk about the disproportionate impact of dementia in communities of color. And I'm going to make the case for early detection. That's really important, and I know that this series, just talking about assessment, is so vital that we'll achieve some of those important outcomes that are needed to improve, to update, and to achieve better rates of early detection. And then the early warning signs. So often people mistake the early warning signs for what they call normal aging. And so as a result, people go undetected. They don't have that conversation with their healthcare provider, and they don't get diagnosed until they're farther along in their journey. And so I want to talk about those early warning signs and try and help distinguish them between normal aging and something that should be discussed with a healthcare professional, because I'm now making every one of you an ambassador to make sure that everybody in your orbit who is exhibiting any of those signs or knows someone who is, please take the time to encourage them to get it looked at. Because what if it's something that's reversible? Wouldn't you want to know about that and be able to address it? So with that, how many of you have seen the annual facts and figures that's put out by the Alzheimer's Association? Okay. Well, it's a booklet that comes out every year in March, and it has just an extraordinary content, ranging from prevalence, who's affected. It talks about caregiving. It talks about costs of care. And this year there was a special section on dementia care navigation. So if you just go to the alz.org website, you can actually find a full copy to download of the facts and figures. But just a quick summary. Did you know that there are almost 7 million people in the United States that are living with Alzheimer's currently, and that 1 in 3 seniors dies with Alzheimer's or dementia? And that's a figure that raises some questions in my own mind, because I've seen some of the data on number of deaths, which comes directly from death certificates. So in a state like Maryland, which has well over 100,000 people presumed to be living with dementia, you see, under 1,500, maybe 1,200, 1,100 people have death certificates that say Alzheimer's or dementia was the cause. So there's an underreporting here, and I know there's not enough, probably in my opinion, not enough guidance provided to those people who complete death certificates, and they may not have the full history. Or sometimes what happens at the end of life, people, their organs shut down, or they stop eating, or they're more prone to falls, and they fall and they end up in the hospital, and the death certificate says fall-related injury. So we're missing the opportunity to fully account for the number of deaths that are directly or indirectly attributed to dementia. So I don't put a lot of stock in that number. I know it's higher. I just don't know how to achieve that higher number, how to quantify that. The other thing is, we have a lot of caregivers that are supporting people living with dementia. In the United States, 11 million Americans are providing unpaid care. And that translates into $18 billion. If you were to put a dollar value on that care, that unpaid care, it would be at 18 billion hours and $347 billion, if you could quantify that. So that's pretty extraordinary. And we know this is a really challenging journey for caregivers. I get calls, I hear from people all the time, and all they want to do is to be able to support their loved one at home for the rest of their life, or as long as possible. And we have some great programs at the state and local level, but we need more of them. And unfortunately, a lot of families are forced to look at long-term care at some point in their journey because the resources are not always sufficient to help them achieve their goals. So join me in advocating for increased funding for those programs that are crucial to enabling families to divert their loved ones from long-term care. And that's no criticism of long-term care, because for many people, it really is the most appropriate setting. But for those families that are deeply committed and want to keep their loved one at home, I hope we get to a point where people all have that option. So anyway, this again, take a look at alz.org/facts if you want to see the whole report. So now let's talk about Maryland. So in Maryland, we believe of the population 65 and older, there are over 127,000 people that are presumed to be living with Alzheimer's, which represents 12.9% of the 65 plus population. So I want you to hold on to that 12.9 number in a minute, because it's really significant, and I'm going to tell you why in a little bit. But we believe we have about 247,000 caregivers in the state that are providing over 400 million hours of unpaid care, that right here in Maryland, if you could put a dollar value on that, would be worth over $8 billion. And we know, again, this is a really tall order. Sometimes the caregivers just wear down. So we have a lot of caregivers with their own health conditions. Some of them, over a quarter, report having depression, and some of them are in really poor physical health. So, what happens if the caregiver runs out of steam before the person they're caring for? All right, so when we look at prevalence, we're looking at mostly 65 plus, although there are people younger than 65 who do have Alzheimer's, but about 1 in 9 people age 65 plus are believed to have Alzheimer's or another type of dementia. So that comes out to almost 11%. And age continues to be the biggest risk factor. So at the age of 85, it's probably 1 out of 3 people who are believed to have dementia. It's lower from 65 to 74, it's about 5%, and then as you can see, it goes up 13.2% between 75 and 84. So it's more prevalent than people realize. And in my opinion, I know there are public health experts in the room, this really is a public health crisis. When you look at the aging of the population and the growth in that population, and how we've been successful in addressing some of the other chronic conditions that used to cause, that were fatal, are now chronic conditions. So Alzheimer's has kind of jumped to higher in the line, number 6 leading cause of death, because we've been so successful at reducing death rates from other things. Like HIV, like heart disease, like cancer. So I'm hoping one day we can see that number, that place in line drop too. So some of you, did any of you see the county level population data that came out last year? Some people, few people. So this was really the first ever county level estimate of the prevalence of Alzheimer's in people 65 and older. And surprisingly, or not surprisingly, the highest prevalence was in the east and the southeastern part of the US. And we also know that there are a lot of demographic characteristics, including these cities that have the highest prevalence have larger, older adult populations, and they also have more diversity that may explain why the prevalence is elevated. So let's take a look what that means in terms of Maryland. Who do you think is top of the list? Anybody want to guess? Baltimore City, right. Any place else in Maryland that stands out? Prince George's County, yes, this is a very highly educated crowd here. You all know your stuff. So this was the result of this prevalence study, and it was on jurisdictions with 10,000 or more people age 65 and older. And Baltimore City was tied with Miami and Bronx for first place. Now, that's not really a place. We want to be first in everything, right? Everything we do. This is not an area where we want to be first. And then Prince George's County is not lagging far behind at 4th place. So if you're if you're wonky and like to look at numbers, I don't know if you can see this real well. So if you don't live in Baltimore City or Prince George's, or if this is new information and you want to know, where's my county? Where do we stand? You can take a look at this data and you can see what the projected prevalence is by county in Maryland. And so what stands out to you on here? Anything? I'm sorry? Well, anyway, I see that Cecil County, 9.8. It's like, oh, we should move there. What are they doing right? We see another few counties that have low rates. We see, Frederick at 10.9, and Queen Anne's is in the 10 range. So, there are definitely differences in what's happening in Maryland. And I'm going to talk about what those higher risk factors are and the impact that they're having. So it's probably not a surprise to you that Black Americans are twice as likely as white Americans to have Alzheimer's or another dementia. And Hispanic Americans are also at high risk, about 1.5 times as great. And then also probably not a surprise to anybody in this room, about 2/3 of Americans living with Alzheimer's are women. So let's talk, anybody want to guess why? Why it's affecting communities of color so disproportionately? All right, got it. So variations in healthcare access, historic health disparities, and other socioeconomic factors probably are what accounts for this increased risk. We also know that in the African American and Hispanic population that vascular diseases tend to be also more prevalent. And you've heard the expression, what's good for the heart is good for the brain. And so it's not rocket science that anything that constricts the flow of oxygen to the brain could put somebody at risk for dementia. So those risk factors for vascular disease like diabetes, high blood pressure, high cholesterol, also risk factors for Alzheimer's and dementia. The other key finding is that Latinos and African Americans are probably less likely to have a diagnosis. So we'll talk a little bit more about that in a bit. So here's another problem, underdiagnosis. Did you know that a high percentage, about maybe half the people who have dementia have not been diagnosed? Does that surprise anybody? Okay. And why do you think that is? Anybody? No cure? Denial, stigma, shame, embarrassment. So we got to get over it, folks. People can't be that way. They're hurting themselves. I see a hand raised in the back. Yeah. Yeah, that is true. Right. And people, like I said, that shame, that embarrassment, they may forget their doctor's name, so they just call them doc. But guess who knows that something's wrong? The receptionist, because they called 4 times for that appointment and they forgot. And then you have family members that are complicit. There's a really great play called Unforgettable that's coming to Baltimore this October. It's going to be at Coppin State University, and it's going to be free, and more to come on that. But it's about an African-American family's struggle with the grandmother who has Alzheimer's, and her son is in complete denial. He says, that's grandma, that's how she's always been. And the other family members are saying, no, not so fast. So it's a really wonderful, dramatic picture of what really goes on in families and how important it is for us to deal with this head on, because we're not doing anybody a service by delaying that diagnosis. In fact, we're going to talk more about the urgency of early detection a little bit later. The other issue is there's a financial reason, because the delay of the diagnosis can increase healthcare costs. It can increase avoidable hospitalizations and can result in better management of healthcare conditions. So, getting people diagnosed and getting a timely diagnosis has never been more important. So in terms of why it's so important, it really makes people pay more attention to changes in memory, in thinking, that may need medical attention. And it really should result in having a conversation. But then there are a lot of other benefits. Obviously, people need to plan. People need to explore treatment options, participation in clinical trials. We've been spending more money on research since I've been with the association for 10 years. When I started, the federal government was spending about $500 million on research. It's now like $3.8 billion. So people are taking this very seriously, and there's more money going into research. But you have to have two things. Besides the dollars, you have to have people. And so you need to have people willing to participate in clinical trials. And not all of them are drug studies. There's all different kinds of studies. Some are looking at, meaningful engagement. Some are looking at caregiver stress. Some are looking at people who don't even have dementia but could be at risk, and are looking to see what are those risk factors that can be mitigated. And the research is continuing to show that there are many that seem to create a relationship between healthy lifestyles and risk for future cognitive decline. Another set of answers, it helps people better understand the symptoms. When someone calls me and they tell me someone in their family was recently diagnosed, I always tell them, go out, learn everything you can, read everything you can, go to education programs, become an informed caregiver, because there is nothing instinctive about caring for somebody with dementia, right? And so often the family members accidentally make a situation become much worse because they say something or do something that upsets their loved one, when if they had known better not to say that, it might not have had that same outcome. Obviously, through better management of other chronic conditions, we could potentially achieve or avoid unnecessary trips to the ER and the hospital. Most people with Alzheimer's have one or more other chronic conditions, so it's especially important to pay attention. Even things like just medication administration. Someone could end up taking too much of something or not enough of something else. I had a member in my own family who had Down syndrome and was also diabetic, and she was very high functioning, and she was able to administer her own insulin, did a great job. She was diagnosed with Alzheimer's in her 40s, which is not uncommon in the Down syndrome population. And one day she went to the refrigerator, she got out the insulin, and there was no insulin. So she took the syringe and she almost injected herself with air. But a family member saw it and was able to intervene. But I can only imagine what that outcome would have been if someone hadn't been there to stop it before it happened. And frankly, going to a hospital is scary for anybody, even cognitively healthy people. But for someone with cognitive health issues, imagine being in an ER, all these strange people, all of them look like astronauts and their faces are covered and you hear things beeping and there's stuff tied to your body. It's very frightening. And sometimes their only reaction is to protect themselves and to start trying to hit somebody because they don't understand where they are and why they're there. So anything we can do to decrease the likelihood that someone would have to go to a hospital ER is much better. Also, this is an opportunity to address safety issues. There are programs that can help, deal with barriers in the living environment that I would encourage everybody to look into. Call Maryland Access Point, learn more about those programs, because the last thing you want is someone with mobility problems falling down the steps. Obviously, legal and financial planning. I have heard horror stories from families where, we'll do it tomorrow, and tomorrow never comes. And now, dad is in mid to advanced level Alzheimer's, and he doesn't have a will, he doesn't have advanced directives, and he's now getting diagnosed with cancer. And one child says, oh, well, we have to do chemotherapy. And the other one says, no, he would not want that. And the other one says, but he was a good Catholic. He would want us to do everything to keep him alive. And here they swear they each knew Dad best, but Dad didn't put anything in writing. And so they're left to fight over it. And even, legal issues, you don't have to be wealthy to need a will. You have to have instructions. You have to know what you have, who you want to have it. So it's really important to be able to participate in those decisions while you can. And then care services, accessing care. People should become familiar with how to navigate that service landscape. Yes, it's very complicated, but people can call Maryland Access Point in their county. They can call the Alzheimer's Association. There are places, and they need to understand where they should be calling. So this is an opportunity to begin lining up services for the future. And then it also helps begin to manage that cost of care. So I'm not going to spend a lot of time on treatment. We all know there is currently no cure. There are some medications that can treat the symptoms, and there are some newer medications that are showing some promise in terms of being able to slow down some of the symptoms. So all I'm going to say about this is, people should talk to their physician. If they're interested in looking at treatments, it's definitely a conversation worth having. There's more in the pipeline. We're hoping the FDA will approve donanemab later this year. I know there's a federal advisory committee that's going to be talking about that in June, and that one showed even more promising results in clinical trials. That's another intravenous therapy where people were on it, and it did what it was supposed to do. It cleared these protein deposits in the brain. It did that. So they suspended the treatment. And a year later, about a third of the participants did not experience any further decline in cognitive skills. So that one is looking promising. But what it's also doing is inviting more investment in the treatment area. And it's like the early days of the cancer drugs. They didn't work that well. They gave people a little more time, a little more quality. But over time, they improved, they got better. And some of them enabled the person to have a chronic disease rather than a fatal disease. So I'm really hoping, I am optimistic that, in our lifetime, we're going to see some progress down the road, and we'll have a better understanding of this and what to do about it. So some of you, I talked about the 10 warning signs a little earlier, and actually, if you want this, there's a bookmark out at the Alzheimer's table, if anybody wants this, just to keep in mind. But these are the things that people so often confuse with what they call normal aging. And so, for example, raise your hand if you walked into a room and said, what did I come in here for? Right. Now, that's normal, and most of us are able to retrace our steps and go, oh, right, I want to get this. But someone with dementia, maybe not. They might not be able to retrace it. Or how many of you have put your phone down? It's like, where's my phone? Where's my phone? Yeah. And if you have like an Apple Watch and you can push that button and your phone beeps and talks to you, oh, I hear it, it's in the other room. Well, that's normal too. But what if your phone is in the refrigerator or the freezer? Not so normal. So again, these are really important things, and sometimes the first signs aren't memory at all. It might be like someone I know, the first sign was the family was getting overdue notices and penalties and fees assessed by their credit cards. And he said, well, I thought I paid it. In fact, he didn't pay it, and then his wife had to quickly learn how to take over the finances, and that was even before there was a diagnosis. So judgment, we worry that a lot of people with dementia could be at risk for scams and exploitation. So even personality changes. Sometimes, someone who's never had a history of behavioral health issues suddenly has what appears to be behavioral health. They're screaming, they're carrying on, or they're really depressed, and never happened before. That could be an early warning sign. So I'm just going to say, again, people carry this bookmark with you. When you know people who you think might need to see a doctor, don't be afraid to have that conversation, because early detection is really crucial. And I'm also going to say the urgency of early detection has never been greater, because these new drugs that are coming out are only going to work for people right now in the early stages. So people who have already experienced significant brain cell death and brain shrinkage are not going to be able to benefit from these drugs. And when you look at the health disparities and when you know that people in communities of color, it takes the average person maybe 2 years to get a definitive diagnosis, and it's double that in communities of color. And so if that diagnosis doesn't occur until the person is much more advanced, they're going to be locked out of this treatment, and that's going to create a whole new health disparity that is not acceptable. So again, we have to really focus. I'm really delighted that we're talking about assessment and how to get people diagnosed sooner rather than later. So now, before you leave, I know a lot of you work in the senior service field. I know there's a couple caregivers here too. I can't walk away without talking a little bit about some of the things that the Alzheimer's Association does. How many of you are familiar with the 24/7 helpline? Okay, good, good. A lot of hands raised. So for those that aren't, it is a phone number where you can talk to a live person 24 hours a day. And it can be something simple like, Dad was just diagnosed. He doesn't have a will or advance directives. Do you have a list of elder law attorneys near me? Sure. Or maybe they want a list of adult daycare centers near them. Or maybe the doctor has said, oh, that's normal, because I've had people tell me when they said to their doctor, something's not right, and the doctor said, oh, that's normal for your age. And so the family knows it's not normal, and now they want a specialist. So they're calling the helpline, do you have a list of specialists? So we are a huge repository of information. We have lists of almost every kind of service that people would want, and they can call and talk to somebody live 24 hours a day. Or let's say it's 3 a.m. and your loved one is experiencing some symptoms that are frightening, and the family doesn't want to call 911 because they know that could cause things to escalate. They call the helpline, they talk to a clinician, and that person is going to walk them through it. They're going to ask them questions to find out, is he hungry? Is he hot? Is he cold? Is he in pain? Try and find out what's causing the behavior and try and address it quickly so it doesn't get out of hand. So again, they can call any time of the day or night, 365 days a year. And, I always meet people who say to me, oh, I didn't know you had that. Oh, I wish I would have known when I was a caregiver. So make sure every one of you knows that phone number. You can always call your also local office on aging, your Maryland Access Point, but 24 hours, and 211 is available 24 hours a day. But if you need to talk to a live clinician, that helpline a number should be on everybody's refrigerator who's a caregiver. We also offer a lot of education and support. We have a number of different programs. We have a series of education programs that are nationally developed, that are delivered all over the country, all over Maryland. I always tell caregivers, look at the schedule, find something, learn what you can. We also have support groups. We have over 40 support groups in Maryland. Some are specialty groups, like our early stage younger onset group. We have a later stage younger onset. We have a Korean language group. I'm looking over at my friends at Howard County for hosting that Korean language support group. We have an LGBTQ support group. We have a Spanish language support group that's having a little trouble getting off the ground because the age of the population is a lot younger, and so dealing with dementia in their families is not a big priority for them, but it will be at some point in time. And then we have virtual groups. We have in-person groups. So I can assure you, whatever you're looking for, they're different days, different times. You can call the helpline and they can help you figure out the best support group that would be a match for what you're interested in. You can also call the helpline and have them do a care consultation. So I recommend that for a lot of people, especially when they've got a loved one with a recent diagnosis, because often the families are like deer caught in headlights. Well, where do I go? What do I do? And sadly, a lot of them tell me that when they got the diagnosis, the last thing their doctor said to them was, see you next year. And so the families are left feeling like, what do I do now? And so they can call and arrange for a care consultation that can be done by phone or virtually, and they'll help the family with short-term planning, long-term planning, and really begin thinking about, what resources might be needed in the future and how to access them. We also have a variety of early stage programs, memory cafes, which is strictly a social program for people who are living with the disease and their care partners, and they just want to be out, have friends, meet people, be with other people who understand what they're going through. And then we have occasional activities like there's a hike coming up tomorrow on the NCR Trail for our early stage families and their care partners. And these are free. We had a pasta making class in January. We just had a virtual art class where people made these flower decorations. So again, they should call the helpline or just look on the website to see what upcoming events might be happening. And also, the website, again, is a huge resource and even has tip sheets that people can download on a variety of topics. So if you want something and you have trouble finding it, all you have to do is call that 800 number. Now, I'm not supposed to talk about brain health because I know that's not the focus of today's meeting, but what I don't want to leave here without really talking about this and framing it as a public health problem and one that we can make a difference in. And so really everyone, we need to raise awareness about the early warning signs. Again, talk about it. When you're with people, when you see people, talk about those early warning signs. And then there is growing research on things that every one of us can and should be doing to reduce our future risk for cognitive decline. So I'm not going to go into detail on that here, but there's a lot of information about that. We did talk about some of those cardiovascular risk factors. You all probably know what they are. And we want to encourage our healthcare providers to be more proactive about early detection. I know that the guidance provided by CMS to physicians when doing the annual wellness visit for their Medicare patients does recommend some cognitive assessment, but the uptake on that is very low. And the reason why I know that is because there's a special Medicare billing code where they could charge Medicare for that time they spend doing that assessment and then the follow-up discussion with the family on care planning. And it's a very low percentage. And I understand doctors are in a hurry. They want to get people in, get them out, get them in, get them out. And if someone stops them and says, I'm having a problem, then they might be late for their next patients. But it has to start in primary care because there aren't enough specialists. And if you were to call a geriatrician or a neurologist and say, I need to have mom seen, something's not right, fine, we can book her in September. You wouldn't deal with that. You wouldn't accept that if you had a cancer diagnosis and an oncologist said you had to wait months. So we've got to do a better job, but we also need to bring more people into the healthcare workforce. We have shortages of geriatricians and neurologists, and we need to bring more people in, and I'm grateful for our academic institutions in Maryland who are working hard to do that. And we've got to connect families with services. I know a lot of people suffer silently, and they're afraid to ask for help. They don't know where to go for help, but that has to end because I don't want to hear another person say to me, I wish I would have known about this service. I could have used that. So I'm just asking all of you to play a role in that. And I know those of you who work in the aging field are already doing that probably every day. And then finally, I want to tell you a story about these three men. And they are all people who were diagnosed with younger onset Alzheimer's. And they attend our younger onset early stage support group. And like most people, nobody goes into a support group happy and excited and head held high. They all kind of go in, they're pessimistic. They just got this life-changing diagnosis and they know where this is going to end. And they're really in a bad place. And then these guys were in that place. They went into the support group and they bonded immediately and they became best friends like immediately. And they enjoy each other's company so much that they can't wait to see each other every 4 weeks. So they started FaceTiming once a week because they can't wait 4 weeks to see each other. So they call themselves the Optimistics. And that's where that comes from. And so they were interviewed by a local public radio station a year or so ago. And it was such a great interview. We started getting calls from people all over the state. I need to be in that group. Can I be in that group? We have a couple that drives in from Washington, D.C. every month. The gentleman on the right drives in from St. Mary's County every month. We have another couple from St. Mary's County coming in. We have people from, others in the Washington area. So, and there's like 40 people who show up every month, and it's a mixture of people living with the diagnosis and their care partners and the adult children, and then they break out into 3 separate groups. So it's the bonding that has occurred is just phenomenal. So you're wondering where I'm going with this story, right? So the gentleman in the middle, Dennis, was a physician assistant for over 30 years until he was forced to retire after his diagnosis. And so it was 2022 where he was a speaker at the Baltimore Walk to End Alzheimer's. And there was a family there who was participating in the walk. And with them, they had a good friend who's an author. And when they looked up and saw Dennis on the stage, they would go, "Oh my God, it's Dr. Dennis. Oh my God, I didn't know he had Alzheimer's." And so they stayed after and they talked to him. And one thing led to another. The author was so intrigued with the story and the story about the optimistics. The next thing you know, he's invited to sit in on the support group meeting. And he was so taken with them and all the families and all their stories, he decided he wanted to write a book about them. And they all said, "We're in, we're in, we're in." So guess what? That book is coming out the end of this month. It's called The Optimistics. It'll be available on Amazon. I'm not doing a book promotion. I'm not allowed to promote books because everybody would ask us to promote books. But what I am promoting is the connection that these people made that would not have been possible if they had not gone into the support group and met each other. And while they all know what this journey is going to be like, they have the highest possible quality of life. They have important connections. The gentleman that lives in St. Mary's County, the group, couple of them have gone down, spent the day there with him, and they just love each other, and they're with each other to the end. And so the author is named Richie Freeman, and he's actually planning to donate some of the proceeds to the Alzheimer's Association. So the way this has been set up is through a Longest Day. If any of you have heard of the Longest Day, it's sort of like a DIY fundraising program. So anyway, if anybody wants to buy the book, they can, but they can also donate because, again, that money is going toward research, it's going toward care and support all over the country, all over the state. So I just thought those of you who work in this field and those of you who are personally affected would like to meet Jim and Dennis and Mike and hear their story a little bit. So anyway, stay connected. Please follow us. Check out our website. There's a wealth of information there. And again, you can always call that 800-272-3900 number if you have any questions at all. So I think we might have 5 minutes, 4 minutes for questions, if anybody has any.